when we originally designed today, there was a kind of debate between Salman and me, and my thinking was that we should just kind of put all of the historians together and have them kind of dialogue with each other. And Salman was like, no way, we really need to have a kind of intersectional discussion, as the jargon goes nowadays. And I was a little bit skeptical. And after we broke for lunch, he was really enthusiastic and perseverating on the same point. He's like, no, we have to lump them all together and put all of these 5 people in, and have a discussion together. You'll be the discussant. And I'm like, okay, sure, let's give it a shot. And I was still skeptical, but after hearing this wonderful group of people talk and kind of seeing the ways in which their trains of thoughts unfolded, it actually began to seem logical to me. And I want to bow to Salman for having seen how this might work. Really we have a kind of evolution of the regime that James in particular and Mona were talking about over the course of the last 120, 150 years or so, beginning with the history that Marcos and Randy were talking about, hinging on the history that Roger was describing, that he cleverly moved in the direction of practical interventions, and then in the direction of the world as it exists today. So we've seen the way in which the reality that James is describing in one setting evolved, and the reality that Mona was describing in another very troubling setting evolved, and we have to kind of come to terms with it. What can we learn from it? What are the implications of this historical evolution? And I think what I pulled out of this very rich conversation are 2 sorts of challenges for people who really believe that there is hope for real social change in the direction of justice for people on an egalitarian basis. One kind of failure that I think all of the speakers in different ways described is a kind of corruption of accountability frameworks. You have stated, frameworks that are on the surface, superficially meaningful, that have been emptied of all meaning by a variety of different devices in a variety of different ways. A couple that came to mind as I was reflecting on Randy's talk were decentralization. The subversion of the Alma Ata movement. Well, if you decentralize, then you're really avoiding the question of upward accountability, aren't you? You're just saying, well, the sphere of kind of meaningful accountability is just the community level. So you don't have to confront a failure of accountability to people who are legitimately in positions of power. Another framework that came up in many people's discussions was, this question of the creation of data, of categories of evaluation, of upward evaluation, whether it's business plans or poverty reduction strategy papers or cost effectiveness analysis or what have you, in which the categories of data are not actually meaningful to the needs of communities on the ground. So this is one kind of failure of accountability. that seem to come up. Another that Salman and I were just chatting about briefly a moment ago is the question of whether the overarching structures are even meaningful anymore, or, as Roger was arguing, were meaningful to begin with. Is human rights a useful tool to people who are interested in intervening on behalf of those who lack power and suffer for it, or in its basic design, as I think Marcos was arguing, is it engineered for such different purposes in such the context of such oppression that it's impossible to use these tools at all? And what I think I heard from James, the last two talks from James and from Mona, was an appetite to really try it out. To say, well, there's a process of evolution. There's a progressive loss of authority of these, frameworks like the United Nations, like the broader constellation of non-governmental organizations. It's unclear exactly where they get their authority from, and therefore their accountability frameworks from. But we should give it a shot, because exactly which direction we're going in is unclear. Others, who've spoken this afternoon, Marcos in particular, and Roger, I think are more skeptical on that front. So the question that I'd like us to to start with, as we kind of engage in discussion with everybody in this room, is first two questions. First, in your view, based on your experience, is there anything that we can use the existing accountability frameworks, empty as they seem, failed as they may be in the particular cases that we've been discussing, moving forward? And then the second question that I'd like to ask you is to bring back a really wonderful formulation that Doris gave us this morning, that seeing somebody and being vulnerable to them is accountability. Seeing somebody and being vulnerable to them is accountability. What would it mean for the United States, for the United Nations peacekeeping operation, or the United Nations as a whole, to be vulnerable and to see the people in Haiti who were harmed by this negligence? What would it mean for those harmed by contraventions of human rights accords to be seen and to be vulnerable in the face of the people that they harmed? Is there a way in which we can take this really evocative formulation and opportunity for kind of grassroots engagement, that we can think about how to operationalize it? So those are the two questions that I'd like to pose to the panelists, and I'm sure other people have questions following this. Mona? I would be happy for there to be, I mean, if people have burning questions that also occur that they want to pose to particular people, that's fine. But maybe if either of those grabs anybody at the table, you can go for it. And if other people want to pose questions in the meanwhile, they can do so as well. Sure, absolutely.
Your questions are so civilized.
Oh, okay.
I want to ask two I want to see Roger and Mona really
Go at it.
Go at it about whether these Mona's saying that these things are built in and they can work, and that that there is accountability. And Roger's talk, there's got the word toothless in it. So we really understand where's the gap between what they're saying? What is that? What would make it happen? What would make it successful? And I was so struck by first Randy's talk about the whole the limitations of you got NGOs like Rockefeller very early on coming in you've got states, and then we see that the whole structure, from what Marcos is telling us, the whole structure is designed to maintain large power, like big country power in the post-colonial period. So this is the legacy of that lives on. Roger suggested this was even designed to be toothless because people wanted to maintain power and not be accountable. So how can we actually count on those systems today, or have they changed? In the framing of it, did they put stuff in that now, 60, 70 years later, we can use to our advantage? And so that's really also, in addition to Aaron's questions, if you guys could really reflect on that.
But let's go from left to right, just so that everybody has a chance.
Okay, to Aaron's questions. I do believe, and maybe I'm naive, that it is a meaningful framework, and we have seen it historically work. It's working right now. So we need to think of the failure in order to inspire greater accountability, not in order to have false comfort, that it works on a daily basis around the world. People who are, hit by a car or some otherwise injured, or heaven forbid killed, or if their property is misused, or if their property is trespassed, or somehow, they are compensated on a daily basis. There's even waivers of immunity that take place in order for such accountability, where there's excessive force, or if there's gross negligence, or if there's, heaven forbid, willful misconduct or criminal misconduct, accountability is taking place. So the situations where it has failed, and unfortunately, they're the most tragic situations, like Haiti, like Kosovo, really are, to me, the exception and not the rule. But there's such huge exceptions that they have to rock the system. They have to be a sounding alarm to the erosion of the integrity of the system. I don't think it's the legal framework that failed. I think it's a human failure. Because every single part of the institution failed. The member states failed, the organs failed, the secretariat failed, the host country failed. Everybody failed to do what was their role in the structure, in the constitutional structure. Not a single one of them came through. It's astounding. So that really, to me, is the fundamental crux of the problem. So it's about holding them accountable, not just for the failure to protect the people of Haiti in this case, or to acknowledge the wrong that had been done to them. And I don't believe that acknowledgement has been done yet. Because while the harm has been recognized, the cause of the harm has not been recognized. And the nature of the wrong has not been recognized. But so what, when you talk about vulnerability to the people who've been hurt, the UN has no problem recognizing the Haitians as victims. But what they are having a problem is recognize them as the rightful owner of a claim. That's the disconnect. They're very quick to look at the Haitians as victims of hurricanes and victims of political turmoil and victims of cholera even. But the fact that they have a claim against the UN and are proper claimants against the UN is where they're having a hard time connecting. And that's a human failure. That's not a legal failure. The same way that when a policeman kills an unarmed man, it's not the law that's wrong. It's the enforcement of the law that's wrong. So we don't throw, what is it, the water with the baby or the bath or whatever the expression is. The legal framework, if righteous men and righteous women were to respect it and uphold it, would work. And I firmly believe that. Quickly to your question, I think the difference is not a question of approach, it's a question of context. Norman is dealing with human rights and humanitarian law violations. It's a very different, it has to be outside bodies that hold that accountability. International criminal courts or national criminal courts or regional criminal courts. This is internal stuff. There are mechanisms in place. There's the local review board. There's the International Court of Justice. There's existing mechanisms that are within the system. We don't have to wait for somebody's court to hold their own national or their own head of state or their own soldier accountable. Those are very different frameworks. When it comes to criminal accountability, it's much harder. It's equally clear, it's equally legally binding, and it's equally unenforced. But I think that kind of accountability is much harder because you need somebody to enforce against an external actor. These are enforcement mechanisms that are internal to the system that should be easily activated and easily applied, much more easily, let me at least say.
So I'm not, I think I'm going to start by agreeing with some of the things Mona said. So we may not have a cage match, but then disagree. But first, some of the things, something that Aaron said. I mean, you were referencing what was said earlier, the to be seen and vulnerable. Just so I'm clear, you're talking about maybe the perpetrators or people who are responsible to have to face with the victims.
That's accountability. That being in that position is a definition of
so I would say to that's accountability. That's a form of accountability within a framework where there's no real accountability. I mean, if I'm a victim, I'll take that over nothing, essentially. But I actually think it's more important, and I've seen this a lot. The victims want to be seen. It's not the, so in other words, that's very important to them, often emotionally and psychologically and from a sense of justice. So to give an example, I do a lot of work now in Burma, land rights. Now that's a hopeless situation. They don't have a legal system, essentially. But the previous method of land grabbing was military-backed companies grab those who object, jailed, or worse. That was it. And so what's happened now with the political transition, which is certainly less than what a lot of people wanted or expected, but there are significant changes. So, and what I found is when we go and we bring a case, what's really important to these local communities who are really marginalized peasant communities, I often say, we're bringing local cases. We're working with local lawyers and going to the local courts. And for people who've had no opportunity to even be seen, whose only experience of power is to be beaten and jailed, for them to go into a court and tell their story and they have to listen. The judge has to listen, the rest of it. It's not the kind of accountability that I want. It's not enough, but it's important. It makes a difference. And in a lot of human rights violations, that's it's not accountability, it's expression. It's I'm here to be seen. But I want to say, much as the framework, I absolutely think that the framework is structurally flawed, and that's a big difference. It's not, I don't put it on the individual case, because individuals can be good or bad, ethical or unethical, but the point is when the structure is no good, you're biasing everything that's going to happen from that point forward. So as an example, looking at the UN, I don't doubt at all that on some of the individual cases here and wherever it is, you can get justice, people can get compensation because it's individual, because it's not calling into question the UN itself. But I don't think it's a coincidence that in all the big issues the UN's been involved with, Kosovo, Haiti, and I would say Iraq to me is probably the most immoral act the UN has ever done, because the US at that point was a unipolar power in 91. The US dictated. We really talked to the diplomats. It was literally going into these meetings saying, you vote or we take 100 million from you. I know that happens all the time, but it was very harsh here. But I think the UN anyway, not just the UN, any institution does not want to accept any liability or accountability if it doesn't have to. That's organizational imperative. But at the same time, the UN, there's not one UN. Nothing is monolithic. There's the UN of the Secretariat. There's the UN of the member states and the Security Council. There's the UN of special rapporteurs and civil society groups who are much more engaged now than they were 20 years ago. So you have to look at it that way. And I'd also say most of the work we did that was exposing of the UN, for example, in Iraq, all the information was given to us by the UN. We would go to Iraq and the local UNICEF and WHO people like, we're having trouble with headquarters. They won't listen. Here it is. And that happens all the time. Within governments, there's, you've got to work with governments, even terrible governments, and you got to find the people who care, and they're everywhere. So I would say we can't ignore the systemic problems. Certainly not when it comes to human rights. But you find the avenues that you can work with within that. And so there's a lot that can be used in the legal framework. And I would, beyond that, the laws are fantastic, actually. Human rights law, if you read it, if you look at it, it's the UN Charter. These are great documents. But it's not a small point that they're not enforced or followed. That's a big point to me. That's the whole ball game. Now, the fact that they exist gives you the potential leverage, gives you avenues to change it. The fact that the good laws exist, but without the implementation, without the ability to make them real, that's the challenge and dilemma.
James.
I guess I'll try to frame this around health issues. And I would just want to sort of emphasize we're talking about human rights. I mean, I think we want to take seriously, social and economic rights as human rights. And when the IMF demands that schools get closed and health systems get closed, those should be seen as violations of human rights and as crimes in some basic way. And there's no accountability for IMF policies in that way. But I would want to, I guess, I think that moving more to health stuff, the WHO's role, I mean, we've heard a lot of criticism, it doesn't have teeth, but, working in places like Mozambique and Cote d'Ivoire, we see WHO guidances invoked all the time. I mean, they're all the time. How do you scale up option B+? Well, WHO has guidance. You have to do it this way. WHO says this is the best way to do it. I think over and over, they matter. They often don't matter, but they often do in really important moments. And I guess what I'm concerned about and wanted to emphasize in this presentation is you have this huge actor in the world of global health in the form of this NGO craziness in the midst of austerity, for which there is virtually no guidance. I mean, there's really no institutional piece there that you can reference to, you can talk about. So I would want to say that I think they're actually models from the human rights world where they're imperfect, they don't work all the time, but if we could at least get that tool out there. And I think just to conclude quickly is that, the enforcement, how does it work, is that need to be tools that embolden the people on the ground. They embolden ministries of health, they embolden national health system folks when they're negotiating with donors, they embolden the civil society and the activists on the ground. And I think there's lots of instances from the human rights world where that has happened by having something stated, some consensus that you can refer to, you can actually act on. It's a tool. I wanted just to bring up just briefly, I don't know how many people have followed the Stella Nyanzi story in Uganda. Just really quickly, because that is a direct human rights issue. She's an anthropologist who made headlines over the last year when she criticized Museveni openly. She's been a very active gay rights activist around healthcare, but also I think called Museveni a pair of buttocks, something like that, in the national media. And they imprisoned her. She went to a psychiatric hospital, but it caused a huge international stir. And people reference the human rights framework, and it has been relentless. Activists within Uganda have used, quoting the human rights framework. And Stella Nyanzi was forced, they had to release her from prison. She is still in jeopardy in Uganda, but is out of prison, not in a psychiatric hospital, and lots of people are paying attention. So, I mean, it's just a specific instance where a health activist has succeeded in getting attention to her cause because of referring to standardized notions of human rights and speaking out. So I think it's, we have to be a bit optimistic that these frameworks and these statements and this kind of consensus around language actually can be useful to activists to change things.
Okay, so I have some random observations which maybe fit together, and I'm not sure. But I mean, when I was at Emory, I had a center that was part of something called the Atlanta Alliance on Human Rights, Health and Human Rights. And it included the CDC, the Carter Center, CARE, cancer. It was a bunch of groups of people who were involved in various kinds of health, but international health. And we met on a regular basis, and we had presentations, and we went for 3 years. And I came away thinking, this is a wonderful framework for understanding the sort of social determinants of health, social economic determinants of health, and the legal manifestations of that. But we didn't come up with a single thing to do about it. And that's why, the framework can be put in place to deal with particular injuries to rectify, but as an avenue for transforming this sort of monster industry, which is global health, I didn't see where it gained leverage. And so the second observation was I've given talks like the one I give today about the sort of limits of global health and sort of emphasizing the same points you made about how, here's these health systems that are crumbling and we're sending in vaccines and we're sending all these things that do good things, but doesn't really deal with the basic health issues people deal with on a day-to-day basis. And I gave it at the School of Public Health at Hopkins, and a student raised his hand and he said, well, what can we do to change this? What can we do differently? And I looked at him, I said, you're not going to do anything differently, because you live in a particular system that is set up in such a way that there's a certain paths of funding, there are certain sets of interests that are involved here. There's your whole school, you're being trained to do research, you're being trained to go out there and do RCTs. And I've been in seminars with students who are doing this, and I say they're all into vaccines and stuff. I said, well, do you know how to go out and set up a vaccine program? And they sort of say, I know how to do the research. It's sort of like, so I think we're dealing with a much more fundamental set of relationships that favor particular kinds of biomedical technologies to put in place to save lives millions of at a time, which is the motto of the Johns Hopkins School of Public Health, and yet is not at all set up to deal with the fundamental health problems that people are faced with. And the money pours into this continual set of enterprises directed at these particular kinds of biotechnical solutions. And until you can, turn the Titanic around in some fundamental way, I don't think the human rights framework is going to help you. I think it's going to take a much more fundamental sort of revolution here. And, I'm heartened by the fact that the Gates Foundation seems to see the lights going on in some corner up there in Seattle. I don't know where it's going to go for that. I'm heartened by the fact that we have a new Director General who seems to be, really attuned to the notion of community health. We have a new director of rollback malaria who seems to think that they need to deal with communities and build up community health systems in order to deal with malaria. All of that's promising. Whether it can sort of turn the ship around, I don't know. But I think that, accountability it's there, but it's something much more fundamental that has to change.
Thank you. I will try to respond as an historian. As the papers in the afternoon, I think, argue, power and resistance to power is what really makes the difference in the history of human rights or accountability. Laws, organizational charts are not really meant to make a difference, at least at the moment when they are approved. And I will give two historical examples that I didn't mention in my paper. In the San Francisco meeting where the UN was organized, and I think that was one of your questions, initially, the UK, the Soviet Union, and the US decided that there was not going to be an international health organization, that they were not going to revive the old League of Nations Health Division, as some Europeans wanted. And it was the effort of a Brazilian, supported by the Ministry of Foreign Affairs of Brazil, and a Chinese, that presented a proposal almost towards the end of the meeting saying, well, we need something like an international health organization. And only a year after that, there was a meeting in New York, basically between Americans, Europeans, and Latin Americans to design the organization of what would be later the World Health Organization, and to domesticate that institution, because, for example, there were several proposals of what would be the architecture of that organization. And the American proposal was the one that was adopted. The only change was the preamble. That is best remembered now by this very idealistic goal that health is not only the absence of disease. The other historical example is that I think that a persistence of European colonialism in the 40s and 50s occurred because there was very little opposition in the UN and in the WHO in the late 40s and early 1950s. The Soviet Union decided to leave the UN and the WHO between 1949 and 1956. The Soviet Union didn't have a strong foreign policy during the final Stalin years and only began to develop an active foreign policy towards developing countries with Nikita Khrushchev in the mid-1950s. China also was absent from the WHO because Taiwan was part of the UN and the WHO. China only entered after the agreement with Nixon. So they were able to design this institution as a perpetuation of colonialism because there was little resistance. I'm not glorifying the Soviet Union of Stalin at all, but there was at the same time resistance. Countries like Liberia resisted this attempt. In other regions, they couldn't do it. India opposed the design of a regional office in that region, similar to the one that was being done in Africa. The same thing occurred with the Philippines, that didn't accept it. Western Pacific WHO organization that was just a repetition of colonialism. So there was also always a dialectic, a dynamic between the effort to impose an order and the resistance to that order. No? So even today, well, this is more in comment as a citizen. In Latin America, there's a lot of conservative forces that try to reduce ministries of public health, like in the case of Mozambique, but there is also a lot of resistance to that movement. So I hope that the ship can turn around.
Okay. Questions from our group? I think, is that Christian? Yep. Oh, Rob, sorry.
Just a sort of a comment about the positive move with Dr. Tedros now being the head of WHO. I think, as well as the huge significance of him having been democratically elected and being sort of the first African to head up the WHO, I think it is very significant, and you sort of alluded to this, that his background is actually not as a medic. His PhD is in community health, and I think this is very, very significant. And you can see that the way he's approaching the whole UHC debate is to very much emphasize the politics of it, sort of responding to the people, and that he wants to take the whole universal health coverage movement to political leaders and to empower people and to be thinking about the accountability. So I think this is extremely promising. And so we've moved away from the stitch up of it just being about the big countries choosing who's WHO, but now we don't have the stitch up of the medics either.
Hi, thanks everyone. It's on. I'm just going to talk. So I have what is probably a naive question, but I feel like I should preface it with, this is not in service of a top-down approach either, but it's a question I want to ask. So across the day, a lot of folks have said the answer and the place to look to begin to talk about starting accountability is the local, right? But we're also working on global health. So if we have this concept of the global as the thing as the space in which we're working, the local shouldn't exist except for the sort of thing that isn't, right? So aren't we asking the already abject or the already marginal or the already other to be the voice that pushes back on this? And is that asking people who are already sick with TB or cholera to also stand up against the WHO or PEPFAR? Or I mean, it seems to me a little bit like adding the responsibility to speak with one's voice to infectious disease. It seems a bit much, right? So am I thinking about this the wrong way, and how do we think with that? And then the second question is about this sort of failing better forward discourse that I have like worked in and with and probably lived. But doesn't this also kind of foreclose a certain amount of accountability, right? So if I can say, hey, I totally failed at writing my last academic paper, but I failed it better than I did the last time, right? Am I like now, is that okay? Do I get to go home and like have a drink and is that accountability, right? So how do these discourses we also set up in the accountability space allow for new forms of moving to the other side?
I'd like to. I mean, the second one is I don't know what to do with that, but I can see all my students now coming up with that. You know, I did better than. But the first question, I don't think it's a question of sort of sitting back and saying, all right, it's your problem. You're going to stand up against these powers. But I think it calls for the direction of resources that are now going in other places to supporting those activities which will actually empower populations to do that kind of thing. You know, and at the national level, as I said, you know, countries need to have the resources to actually do the research, to do it on their own, to design their own programs, to figure out what is actually best for them. Right now, that doesn't exist. So I think it's calling for a redirection of resources to allow that kind of resistance to actually occur.
Exactly. Yeah. I mean, this is a principle that's very dear to my organization. And the organizing principle is that no decision making or negotiating should take place that does not include the voices that are affected by that decision making. And I think that's what we mean by empowering the local. That it's not that their job to come reach the global. No, the global has to reach to them and hear from them and know what their needs and what their demands and what their actual circumstances are. But the failure is not your failure to live up to your responsibilities. It's the failure in making sure those who have failed their responsibilities are either at least exposed and hopefully held accountable. And if you fail in that, then it's not your failure. It's the fact that you didn't succeed in holding somebody else accountable. So I mean, I think that's the critical juncture. So if at least you expose it, at least you bring awareness to it, you have achieved something, even if ultimate justice is not fulfilled, but there is some justice in at least exposing the wrong. So failing forward, I think, is, you know, it's not my principle, but I think that's how I understand it anyway. It's not that you did less bad, because it's not your failure that's at issue. It's somebody else's failure to be accountable for a wrong that they committed.
James and then Tom.
Yeah, just an example about your first question. In Mozambique, there was a really interesting story when PEPFAR first came to Mozambique. Mozambique was a very important PEPFAR country. But before PEPFAR came, the Western European donors, with support of Clinton Foundation, HAI was deeply involved with the ministry in writing what they called a business plan for the scale-up of antiretroviral treatment before PEPFAR came. They had a whole plan, whole strategy of how to do it. How they're going to buy the drugs. And then PEPFAR emerged. It arrived in country and said, here's the way you're going to do scale up. And the ministry, which was headed by a guy named Francisco Sangani, who was a real health activist and a really great minister of health, convened a meeting, and there was a showdown in which Francisco Sangani, with the support of like-minded, mostly Western European donors and others, with the Clinton Foundation, actually, and HAI in the room, pushed back against the PEPFAR reps and said, no, we have a business plan. We're going to do it this way. We're not going to be using any money to buy commercial, private pharmaceutical drugs. It's all going to be generics. We're going to do it in this certain model. We already have a plan. Either you sign on to our plan or we don't want to work with you. And it was that kind of pushback. And when I'm thinking local, it's often, you know, the local health system, right? The local people that are trying to build a health system. Now, there was a partial victory because PEPFAR still came in and dumped all their money on NGOs, but they won some really key pieces. And they were able to push back because of solidarity from like-minded health activists. And they were able to reference the big global debate around generics. Right? And they were able to tap into that and push back and fight back. And so I think you see the same instances in places like Rwanda, where you had a very strong health minister who pushed back against NGOs and donors and got some success there. So I think it's, at least what I was trying to talk about was providing tools for local entities, whether they're organizations or health systems, to push back against these very powerful forces. And I think there are instances you can find where that's been successful. In terms of the only reason why I used failing better because it came up this morning, so I threw it in at the end there, is it's a psychological move so that you can empower yourself to do things that you have a feeling are going to fail, because you just have to do it, or else it's a tough world out there, and you got to try these things because there is a good chance you'll fail. But if you can opt for failing better, that's better than not doing anything. I think that's my rationalization.
Tom.
I just want to make a quick comment on that, because I also was very taken with the fail better. I've already decided it's the title of my new book. No, but I think what's meant as it's not personal failure. It reminds me, there's a T.S. Eliot poem, which I'm going to paraphrase, but it's, "We who are undefeated because we never stop trying." That's what I think is captured by that. Then very quickly, because the discussion about the privatization, the NGOization of health, it really strikes me. I mean, that is an extension of SAPS, right? It's like the whole model is, SAPS is government level, right? You want to destroy the government. Health to me is the ultimate public good. Has to be a public or a human right, whatever you want to call it. No one is going to give themselves health, right? So that's a very dangerous trend. It's actually what's happening in this country. I mean, the Bannon model is kill the beast being government. So, government has all kinds of problems, but you're not going to get health or education or basic goods without, the point is to strengthen government, make it accountable. That's the point, not to just give up, because there's an ideological reason why people push that, and I don't like that ideology.
Tom.
Yeah, just a couple of comments. So I'm part of the NGO industrial complex, although I'm a very small, scrappy NGO, probably even smaller than yours. But I just want to make a couple points. One, I was actually going to use the Rwanda example. I was in Rwanda at the time, working with the Doris Duke Foundation Africa Health Initiative grant. So this all comes full circle, because one of the PhDs, the local Rwandan PhDs that was so extremely instrumental in getting this kind of donor fragmentation taken care of, at least temporarily, was then poached by Gates within weeks after that happening. But that's another story. So he went off to the West Coast. But I wanted to mention the Rwanda example as, what in the spirit of Roger's Leninist note of what is to be done. Right now, you do have this money, though, directed towards NGOs. And how can the groups sitting between the bilateral donors and the governments act as some sort of bridge to push it back? So in our case, I was working with Partners in Health at the time, but we have a tiny NGO now. So I'm thinking what we've been trying to do in places like Chennai and Durban, and our partners have been doing in Karachi and Kisumu, Kenya, is looking at, with existing funds, how can you interact with this idea of the local, which sometimes the local is as big as the state of Massachusetts in the case of Chennai. So it's only local in certain senses. But can you use the government that the local population, the affected population, interacts with? And in Chennai, that's complicated due to the British historical legacy of there's a municipal corporation and an elected mayor and all kinds of polycentric kind of arrangements. But who can we engage with there to just get TB on the table, for example, and make it seem like it's part of this broader idea of health improvement across the city? So there are like steps in between that we're trying to explore for how you don't have this meaningless idea of local that can kind of obliviate people, but also, understanding that it needs to be driven by Chennai. Particularly given their history and the research of TB, it's madness that we're even there. Honestly, we should be gone. So the other point I wanted to make, as a small NGO, on a self-interested note, in the area of unintended consequences. So if the NGO code of conduct, like so many other large regulatory bills or arrangements from my study of public policy, be it in agriculture or even the Affordable Care Act, the large players get exemptions, or they design the bill so that it leads to consolidation. And I am down the road. Going from my office to FHI 360's office in Durham, North Carolina is also quite a thing. So I'm just thinking they would be involved from the start. How do you think strategically you would avoid consolidation by the Beltway bandits if such a thing were to take off? Because it wouldn't be PIH, it would be PATH, it would be FHI, IntraHealth. They would be at the table. That's just a thought.
Is that a question? Should I answer
No,
that?
no, no, go.
It's a great question, and in formulating this whole talk, that's the looming problem. In some ways, I feel like if we take this seriously, and this group I'm working with is thinking about trying to draft some papers to push this idea a little bit, it might even be considered sort of a victory that we have that kind of confrontation. Because I think you're absolutely right. The big powers, especially if it's going to the WHO, are just going to try to snuff it out in any way they can. Right, they're already trying, and so. But I think that that's where politics happens, and it would have to be a movement to some extent. There needs to be a lot of activists involved in it, and there already are some scattered around. And if we're able to get some momentum on it, just having the discussion and sort of the confrontation with those particular actors would be interesting. And within AID and within some of the big donors, there are like-minded folks, interestingly enough. And we don't want to underestimate that. There are strategies, I think, that you can kind of mobilize actors within big institutions to possibly become allies. We've even seen this in Mozambique, where AID people were steering money in certain ways because they knew the health system needed that money.
In Chennai, at least the country mission for AID did direct the money after it took over a year to do it. And it took some interesting financial engineering. Yet there was direct budget support to the Municipal Corporation of Chennai, which you can imagine was not an easy thing.
So having big public arguments with FHI 360 and others is a dilemma that I would love to have.
His question is about Mona? The term that you used?
Premièrement, Mona t'a posé une question sur le rapport entre Haïti avec Belgique.
Mona, you posed the question between Belgium and Haiti.
Moi, c'est qu'il y a trois problèmes.
He said there are three problems.
Et premier problème, c'est discrimination.
The first problem is discrimination.
Et clair que si choléra est arrivé aux États-Unis
It's clear that if cholera happened in the United States
et au Canada
or Canada
et en France,
or in France,
la communauté nationale a le même comportement par rapport avec Haïti.
the international community would have the same response as they had.
Peut-être parce qu'Haïti pas un gros donneur et c'est un pays pauvre, un pays noir.
Because Haiti is not a big donor, but it's because they're poor and they're a black country.
Donc, c'est un problème de discrimination.
So it's a discrimination.
Et deuxième raison, c'est sous le leadership et Ban Ki-moon.
It's the second problem is the leadership of those people.
Et Ban Ki-moon, le secrétaire général là.
The Secretary General.
Et il était tout utilisé le leadership,
He-
il était contourné que c'est eux-mêmes qui sont responsables. Par exemple, il était utilisé CDC, il utilisé Organisation mondiale de la santé pour bailler mentir.
He used his organization, the CDC, and he lied about the situation.
C'est vrai qu'on manque de leadership tout
The-
en Haïti par rapport à l'État haïtien. Je ne peux pas faire de commentaires sur ça.
Haiti does not have a good leadership, so he's not going to comment on that.
Même je ne pas c'est parler de problèmes, yo.
I don't think it's just talking about the problems.
Mais qui solution? Il faut parler sur solution.
What's the solution? We should talk about the solutions.
Ça me le dit, et peut-être mon attaque qui mécanisme Nations Unies mettent en place, les gains problèmes ça arrive.
Mona, maybe you could speak about what mechanisms are in place by the World Health Organization or the UN.
Et pour qui ça, il n'y a pas jamais implémenté so far. Par exemple, article 55 l'an dit, il y a dû mettre une commission de réclamation permanente. Et ça fait 13 ans. Nations Unies, ministre après l'aller, il va aller mini-juste, il n'y a pas jamais mis en place.
It says it's been 13 years. The article has been in place, and the leadership is going to leave, and it hasn't been addressed.
Okay, c'est parce que
It's just because it's a technical legal term. The article that requires the establishment of a standing claims commission has never been implemented in Haiti, and it's been 13 years of MINUSTA's peacekeeping mission being in place, but that article has never been followed.
Mais ça nous tout besoin connaître dans forum ça yo, c'est que choléra c'est pointe iceberg là.
He's saying at Haiti, cholera is just the tip of the iceberg.
Mais l'autre, par exemple, dans pour petit casque bleu yo, et qui journée jodi a, yo pas gen droit à la santé, yo pas gen droit pour qu'on non papa yo, pour te non papa yo pas gen droit à l'éducation Ça sont l'autre gros problème tout.
There are children that they cannot have their parents' last names. They don't have access to education. So that's a big problem.
Et yon gros problème nan, c'est parce que nous pas jamais qu'on ait dit vraie raison qui fait en 2004 et Nations Unies voyaient soi-disant soldats de paix ça en Haïti.
He said the one of the big problem, we never knew why the United Nations in 2004 sent all these soldiers to Haiti.
Donc, c'est des problèmes si nous kembe ou dans hypocrisie, dans traité dans forum ça yo, nous pas parler de yo, parler de problèmes sans chercher solution, qui mécanisme?
He says if we keep talking about it and not putting a mechanism in place, there will never be any solution.
Et yon problème non pas trop d'accord avec, par exemple, c'est vrai non d'accord, Philippe Abston dans rapport là gon impact.
He says one of the problems we don't agree with you, but Philip Abson has his report has a major impact.
Mais cependant, faut que nous te porter plainte là.
But we should have filed a complaint.
Et c'est ça qui fait média yo. Mais non qui système pas un système, non seulement utilisons prétexte.
He said there was not a system for the media. It's solely a pretext.
Est-ce que nous cap toujours utiliser prétexte pour nous faire Nations Unies, qui fait promotion pour droits humains, respecter droits et moun?
He says, can we use the pretext that the United Nations is going to respect the rights of people?
Can I just add one thing? I mean, I think just to add to that, I think I personally agree with Mona's point that perhaps we don't need a revolution when it comes to defining the obligations that the UN owes, at least in situations of private law claims. But that the problem is that we do need a revolution when it comes to the ability to enforce that. And as Mario said, I think as long as our system is one that's dependent on an absence of racism, on the leadership of the UN to comply and police itself, and on states to act on behalf of their citizens, that means that the system is broken. And so I think maybe a combination of there needing to be a mechanism that actually empowers citizens and victims to be able to directly confront the UN and other international organizations, as well as also a broader empowerment of people to be able to respond with public advocacy. And I think maybe one point of disagreement is that I, not to be too self-aggrandizing here, but I do think that the Haiti case, though, is at least a partial success story when it comes to the ability of public advocacy to overcome systemic failures in accountability. And in my mind, it seems that we can kind of separate out the two, but what we need is both reform in terms of mechanisms that are truly democratic and that don't depend on states to intervene on behalf of citizens. Because as long as we have that as our system, then the most marginalized will never be able to truly find accountability. But also, again, that mechanisms alone are unlikely to be enough, and that even if we had a standing claims commission in Haiti, most likely we would have still had to depend on huge mobilization in Haiti and transnationally in order to be able to actually see that translate into justice for the people. And so I don't think that we're there yet, but I'd like us to explore kind of both of those at the same time.
So, Mona, do you want to respond?
I'll try. And there's a lot there, but I'll try to address all of it very quickly. Indeed, yes, I did raise those three questions. Is it that the victims in the DRC were white and the victims in Haiti were not? Is it the fact that the Belgian government was more adamant about litigating on behalf of its citizens than the Haitian government has been? Or is it that we just have weaker leadership than we did back then? And I think all three are obviously at play. But do we have to wait till racism no longer exists on the planet? I don't think so. And we don't need all of it to be corrected in order for the system to work. We just need one player to live up to their role. When the Haitian government stood up to the sexual exploitation and abuse that happened against the children in Haiti, the parliament actually adopted a decree commanding their government to raise it with the UN. We saw that happen. There was a parliamentary bill that passed, and the next thing you know, there were Pakistani court-martials in Haiti of Pakistani soldiers that had abused children. A few years later, the Uruguayan soldiers were accused also of molesting a child, and they were held accountable. So when the public in the country concerned activates its own role, very simply by going to its own representatives in its own parliament and demands justice, something happens. When that government then translates that at the international level, something happens. That didn't happen, so there's some accountability missing there as well. Now, the biggest failure, of course, is the UN's own failure. It shouldn't need to be asked to do the right thing. If it, as the moral voice of the international community, fails to live up to its own moral responsibilities, then what kind of advocate for responsibility is it? The previous report of the former Secretary General, that those who wish to invoke international law must themselves abide by it, is fundamentally at play here. It loses its only weapon, its moral credibility and its ability to ensure moral outcomes and just outcomes if it itself does not live up to its responsibility. As a purely practical matter, not even as a humanitarian or moral one. So Article 51, it's important to note that the Standing Claims Commission has not been activated anywhere at any time. But that doesn't mean it cannot be. And the organization itself, in those two reports that I referred to, maintains that even though it has never been used, it should remain on the books because it should remain an option. And they surmise that the reason it hasn't been activated isn't a lack of justice, but the fact that member states and claimants alike have been satisfied with the claims review processes that do deliver more efficiently and effectively an immediate claim resolution or dispute resolution mechanism. So it's not just in Haiti that those standing bodies don't exist. The problem with Haiti is you didn't even have the local claims review boards. It was immediately referred and it was immediately politicized, given the magnitude of the crisis. So last but not least, I think there are, I agree with you entirely, many different kinds of failures in Haiti of the international community and of the UN. The mandate of MINUSTA is to fix the security sector, to fix the judicial sector, to ensure that the human rights standards are respected, to ensure that peaceful transitions of power are actually emerging, to help rebuild after the horrible earthquake, and of course now to put in rehabilitation and corrective measures to ensure that the cholera epidemic does not break out again. And one can certainly argue that they have failed on several aspects of those mandates and probably succeeded in some. But a failure of mandate is a very different thing than an accountability or a liability for a wrong done. And I think today's conversation is about not acts of omission, but acts of commission in this case. And while accountability should be demanded on both, it's more urgent that those who are victims of a wrong have those wrongs addressed.
Thank you very much for the wonderful submissions. I just had one thing to say, and I think, just so I can see there's so many hands and I don't want to waste time. And it's about this whole definition of what an NGO is. Because to be honest, from somebody speaking who comes from the South, we really feel that northern NGOs have taken over this space and have led to the shrinking space of civil society within our region. So we're seeing that a lot of the international NGOs are getting a lot of the funding, and then we are used as, the minions that do all the work, and then we have to report, for instance, to the HIV International Alliance, and then they're the ones that report to a donor. So there's nothing that actually helps us at the end of the day to hold our governments accountable while they come up with these NGO acts that shut us down. So I don't know what we call ourselves. Am I civil society? Are you an NGO? And what is the definition around that? Because if we're now also coming up with codes of practice, who do they apply to? Because we, the people that live there, who are the locals, who are the natives, who are the ones who are supposed to hold our governments accountable, are even struggling to do that work because, as I've just stated, because of these issues. So I think I would like just a definition to be given to me and how we separate between us as African NGOs, as it were, and international NGOs, because it makes me feel really uncomfortable because money doesn't come to me. It goes to the international organizations like FH360 and so forth. Thank you.
Do you have a
Yeah, I
comment?
just want to follow up. It's directly related to what Lynette just said. Yeah, I was going to say that sitting kind of as one of the, as an activist group, I'm with Treatment Action Group TAG, and as the policy director in DC, looking at the sort of kind of construction of some of the advocacy tables in Washington who are, I think, supposed to be, in my mind, in service to the work that Lynette and other folks are doing, you know, in country. What I see a lot of and have been really kind of astounded by as somebody who, particularly working on the TB side, as opposed to coming from more of an AIDS orientation, is a lot of the kind of implementers, the PDPs, and some researchers who really kind of set the policy agenda, which is often very self-serving. I'm often kind of interrupting like kind of discussions and kind of strategies for what we're doing, you know, in terms of our advocacy, in terms of funding on the Hill or legislation or whatever, that to me, I'm like, this is serving you because you are USAID grantee or a PEPFAR grantee, right? And I'm not going on the Hill to advocate for your money. So, so there's that dynamic that I think, you know, kind of has to be addressed. And as I think expressing sort of some of the fights with FHI 360, there are a number of other groups, frankly, who fit that category. And it's, like I said, some of it has just been kind of astounding to me when I started at TAG 4 years ago, almost to the day. And I went to the union meeting, which was that year in Paris, and Mark Harrington, who you know is my boss, sort of laughing, knowing that I came from more of an HIV activist background, said, ha, what do you think about your first kind of international TB meeting? And I said to him, I said, Mark, it's like walking into disease management of the colonial powers 1917. I was like, some of the things I have seen the last few days, like AIDS activists would burn this place to the ground, right? It wouldn't happen. So that's a side note, but I do think there is an issue when we're talking about the kind of advocacy and thinking about the sort of relationship that like U.S.-based or, you know, kind of northern-based, if you will, sort of NGOs or advocacy groups have, you know, to the groups in the South, that isn't self-serving about, you know, just kind of making sure that your own programs continue to be funded, you know, ad nauseum.
James, did you want to respond?
Well, if that,
or did you have a
that makes
thought on
sense.
that train of thought?
That's the best funded foundation, is that right? No, I'm kidding.
Yeah, just a great question about how we define them. And just in terms of what I was discussing around the code of conduct, very much focused on the international NGOs, the big NGOs that are getting the lion's share of the money from the North. I did want to point out one, in relationship to local NGOs, one of the insidious things that's going on with global health aid is in response to criticism of too much money going to northern NGOs, USG funder donors, including PEPFAR, but also USAID and others, are demanding that recipients gradually transition to local NGOs. And so what that has meant is that the big PEPFAR implementers like EGPAF, Vanderbilt, ICAP, they're all creating local versions of themselves. And I mean, you sort of laugh. Right. Yes, that's a good research question. It is really, and they're not even trying to pull the wool over people's eyes. So Ariel is the EGPAF local version. It's called Ariel in Cote d'Ivoire. It's called Ariel in Mozambique. And so Ariel is the local thing that's controlled by EGPAF, but Ariel gets the money and then subcontracts to EGPAF, right? So the money goes back to the big NGO, and that's the new move that's being done. So it's, you know, don't be fooled, I guess. And of course, it's leading to a proliferation, even more NGOs, more people getting their cut of overhead, the whole thing. In terms of, I guess, what I would call genuine local NGOs, right? They are vital and critical and starve for funding. And I think speaks to your point as well, is just pointing out the way in which the North American NGOs are in it for themselves and follow the money, and that's been the name of the game. And is there a way to rein that in? I wanted to make one final comment related to the gentleman who was speaking in French, that this whole picture is really about race and discrimination at the end of the day. It's and it starts with, I was really struck, I'm sure others were also struck by, when austerity was imposed in Europe, there has just been an unbelievable outcry, which is great. It's front page news. We had Paul Krugman writing op-eds about it, talking about how terrible austerity is, which it is, and it was good to see that. But it was like, my God, this has been going on in Africa for 30 years, and nobody paid attention to it, at least in the mainstream. And I think it's because it's poor and it's African and it doesn't matter. And it's in Europe. It's like, oh my God, you can't close our schools, you can't cut our health systems. And I think it trickles down, the way in which race and global health plays out is something that people don't talk about enough. Most of the NGOs, are quite racially segregated. The leadership is often white Americans. There's a lot of white privilege being enacted and all of this stuff. And local NGOs aren't trusted with the petty cash. They don't have administrative systems. We can't give them money. They don't know how to handle it. It all has, I think, very, very real racist undertones or overtones to it. So I think that's an added, really important dimension to all of this and the North-South relations.
We'll follow on the NGO discussion. So earlier, or this week or last week, we had Jim Ferguson from Stanford come out, and as many of you know, he's famous for a book he wrote in 1982, I think, about Lesotho called The Anti-Politics Machine. And the anti-politics machine is exactly kind of what we're talking about here, where in his book, it was the World Bank, but here it could be the UN or the WHO. It takes a problem like the cholera epidemic in Haiti and says, all right, we're going to break this up into technical bits that are manageable by experts. And so they call in the epidemiologists, and the epidemiologists say this outbreak was caused by a Nepalese soldier that came over to be part of the protection force or whatever it's called, and so that's the explanation. And now we've got the best minds in the world working on how to get justice for the however many hundreds of thousands of people are going to be affected by it. I myself am an infectious disease physician and anthropologist. I do not think a Nepalese man coming over with cholera was the cause of it. I think structural racism was the cause of it. And so if we're going to spend our time talking about what accountability means, why aren't we using these resources to, say, litigate for reparations from France and the US government? Because we go a little more distal, and we could easily trace the conditions that set up the outbreak there to, propping up dictators, transnational slavery. I mean, you can keep going. And so we are the ones who are actually going to decide this for the people out there. So I'm wondering if we could be a little more radical about it in what we produce.
I have a question for I guess Jeff first, and then a couple other things. Jeff, when you showed that quote you showed earlier from somebody at Gates, I'm sorry, James. When you showed the quote earlier from someone at Gates saying that, oh yeah, their problem with the MDGs was too much money was going to too many NGOs, and we have to get more money to the health ministries. That was amazing for me to see too. I mean, I was really glad to see that. I mean, your aside little point that wasn't Gates also criticized for the same thing also, like, okay, setting that aside, if that is indicative of a possible new strain of thought within Gates, and we all probably hope it is, if it is, won't they sooner or later bump up against the so-called IMF problem? If they agree that, putting all the money into NGOs isn't really the answer, and you need to strengthen the health system, the public health system, then are they going to say more Gates money, more other donor money, more money should come in from the outside and go to strengthening the health system? Won't they bump up against the IMF problem? That's my question for you. For Roger, I have more of an ongoing question. Mona and I think Mara over here is trying to pour water on my idea, but I still haven't given up. I want to know if the IMF and the World Bank as specialized agencies of the UN, can they be held accountable for violations of human rights, specifically the human right to health in the case of user fees? Does CESR or you personally have an opinion on that? And regardless of what you say now, I really want to follow up with you on that anyway later. And then my last big question comes to this woman over here. I'm sorry, I don't know your name, but something you said this morning has been on my mind for a long time. And you said the magic word, punishment. For the entire panel, I want to ask you, can you have any type of system of accountability without punishment? Can an organization or institution be punished in some way? Can key individuals be punished? Can they be decertified, sanctioned, pay fines, go to jail? Can you have accountability without punishment? That's just a very abstract, vague question, but it's one I think I would love to hear a concrete answer to. Thank you.
Yes.
Thank you very much. My question is is there any sort of accountability mechanism for those who just create some sort of unrest? Like I was studying Salman's work in Tajikistan, and it was mentioned millions of people die in those unrest years, and because of this some sort of policy of Cold War and its after effects. And the other question is more, I went to some of the tribal areas last year with one of the German PhD scholar. He was conducting his research on drone attacks. And I got to know that there were majority of people who were very innocent people, but there was attack. And in finding one terrorist, some other innocent people die. What is mechanism for those, like if NATO is doing its operation there and all of the things are going to be, and how they can. And my last question is, I don't see a difference between the ideology or the narrative of these international financial institutions as compared to the ideology of my local land owner. Like they just cut off aid on education and health. They don't want people to have education and don't have power to answer, power to raise a question for accountability or for their right. Same is the context, the area where I belong to. There was no concept of education. My local leader never wanted to upgrade a middle school to a metric to a graduation level college. So how does this happen? Is there some sort of difference in these two ideologies? Thank you.
So once you introduce the issue of accountability, there's no end to what could be included in it and who could be held responsible.
Should I answer Rick's question? And then bumping up against the IMF problem. Now, Rick has written a book called, what's the exact title? How the IMF blocks AIDS
Very
treatment.
subtle.
Yeah.
So I was actually going to ask you exactly the same question because I think you're actually the expert on it. I think that should the Gates Foundation move in that direction, it will bump up against the IMF problem. Again, in a way, that's sort of a dilemma. It would be nice to have if there were some powerful actors saying, you got to expand the Ministry of Health budget, or we can't deal with HIV. We need to hopefully move in that direction, and how that will be manifested, I don't know. I mean, I think it's exactly the big problem, but and it'll be a fight. It'll be a serious political fight in the way in which austerity in Europe is, I guess. But moving in that direction would be good. I think one of the bigger dangers with Gates and others jumping onto the health systems bandwagon is, what do they mean by a health system? And what they might mean by universal coverage is universal coverage by Signet and other, but insurance. Yeah. It's an opening for private insurance. So keeping it focused on public sector national health systems, I think, is going to be part of the struggle there. Punishment, really quickly, I think it's a great question. Is the IMF too big to jail? Probably, but I think it's really important. It's when you saw the IMF response to the Ebola outbreak in West Africa, I mean, it just felt like a crime scene. Talking about how they had really restricted these health systems, and look at the calamity that basically they helped create. No accountability there, no sense of should somebody be fired for what they've done. So I think it's a great question, and wouldn't it be nice to kind of begin to talk about those things more directly? And about, your question was complex, and there's accountability around drones, accountability around all those kinds of things, and the drones are sort of a more the use of drone. I'm not sure if I caught your whole question, but how do international institutions sort of track all these different kinds of things that need accountability? I just think around health, when you have the kind of contractions of health systems that we've seen, they're like 1,000 drones targeting civilians, and there really needs to be the same kind of discussion. It is violence in a very real sense. And so far, we have no good tools for tracking it and punishing.
I'm sorry that we're going to have to end the conversation now because it is 6. This is such an interesting part of the discussion.
But hold these questions. And
hold these in your mind, because tomorrow the idea, I think
many of us will be there. So
tomorrow, the idea of can we take this a step further? Should individuals be sued? Mona used the term that many organizations are getting off scot-free. The contractors, other people. Are there different levels of accountability? Aaron brought up the thing of what facing people, and Roger, you said that when people were in court, just even speaking and facing, is there something about maybe taking people to court, or some sort of tribunal? So what, that's not a UN, something else. I think let's keep all these things in our minds as we go through the 3 cases tomorrow. So thanks everyone for an awesome day. See you at dinner shortly.